Hi, good evening. Got a minute? All right, let's go over some of the numbers. Let's talk then a little bit about the budget that the manager laid out today. We're going to go straight into the first dashboard. Always looking at the hospitalization numbers first. 68. 68 is down from yesterday's 73. Important number. It's down from the 7-day average. You recall last week we were up at 75. You look at the dashboard, there's a graph in the middle. Doesn't have a lot of detail to it, but you can see how in June we were facing this incredibly steep spike. That's when the community got engaged, started wearing masks again, started spending more time talking about social distancing, more time at home. People responded, and you can see what's happened to the curve. We'll talk about that in a second. That's good work, but we are still on the edge, so you can't let up. Can't take your foot off the brake. Really, we need to get used to wearing these masks for an indefinite period of time, social distancing for an indefinite period of time, because we're precarious when you look at some of the numbers that we have with respect to ICUs and hospitals. That's the problem right now that they're facing really in Houston and Dallas, where folks are not being able to get into hospitals right now in those cities. Not the case here, but we need to try to prevent that from happening. Take a look at the other side of this first chart. It's the new cases today, 657. I think that's probably kind of an artifact of a weekend. Less cases put in, processed by the labs as you go through the weekend. Sunday's number was similarly artificially low. So yesterday's number was 166. 166 and the 657 get you to just over 800, a 2-day total of about 400 each. That's probably a better way to take a look at those numbers. Doubling time about 25. Take a look at the mint colored numbers on the bottom. Our 7-day average for hospitalizations, 448. Tonight in our hospitals, we have 459 people. So we're at just about, but still above our 7-day average. Hospitalizations are increasing. In our ICUs, 7-day moving average, 143, you see at the bottom. Our census today in our ICUs is 151, which means our ICUs are increasing at a higher rate that are going up. When we talk about capacity in our ICUs, comfortably, you're talking about a number that is, regularly available for COVID patients, about probably 225. Hospitals can expand from that, get up to the low 300s, but that's pretty much using all the devices and staff they have to do that. Physical space, they could go up to just over 400, but that's going to require the state, some third party to really help us bring in staffing, and we can't be guaranteed that right now. A lot of cities in Texas are going after additional staff. I know the state's trying to bring in additional staff, medical staff, from the federal government, from the Army, and not something I think that we can count on. So you can see, ICUs, our numbers not too long ago were significantly lower than that. Just over a month ago, we were down at 20 as a 7-day moving average in new admissions. It's tripled in that period of time. But we were under 100 for ICUs not that long ago. We were at 71 ICUs, people in ICUs on June 20th, 71. So that number, and doubling in that period of time, if it doubles again, if we get up to 280, 300, you can see how that falls within that range that we're just incredibly limited and pulling everything we can in order to be able to make that work. So we are on the edge, and we need to keep ICU count down so that we don't endanger the doctors and the nurses, the skilled technicians that are in our ICU. On ventilators, 88 is our 7-day average. There are 86 on vents tonight in our hospitals. Why don't you go to the next slide, Anita? This is the other dashboard that we have. Again, new cases today with a 657 that got us up to total cases of 15,445. First time we've gone over 15,000 cases. Deaths in the city today, 172. That's 3 more people. We've had more significant increases in folks passing away here recently. I have a chart I'll show you on that in just a second. The green numbers there are the daily census numbers, which we just went through together. Let's take a look at Dr. Escott's daily charts. The first one, the important one we track, admissions. You know, if I was going through a different this pandemic a second time, knowing now what I know then, we would probably be looking at ICUs in addition to admissions, and not just admissions. The blue line is the actual number. The yellow line is the 7-day running average. It kind of smooths out the ups and downs by using a 7-day average. And you can see the spike that we were having. And the fact that it's kind of tailed off here, kind of leveled out. That's the number we want to try to level out as best we can. Or, you know, boy, in a perfect world, we're showing incredible discipline with masks. And we can get that number to actually go down. You know, I was being asked by some other folks around the country, what is the lesson to be learned from Austin's most recent experience. And I talk about the fact that, you know, when you open up the economy, we need to learn to do it in a different way than we did it, so that we can sustain it better than we've been able to do that in Texas, which means we need to be more innovative and adaptive about the way we open things up. But the other lesson that you can really learn in Texas is just how important it is to wear a mask. I mean, when you think about the difference in behaviors that we have now versus the behaviors that we had when we were just screaming with that line going up, the single most important difference is that there are more and more people that are wearing masks. I'm still shocked is not the right word, just incredibly disappointed when I see people in groups of other people that are not wearing masks. It seems such a selfish thing to do. I understand liberty interest. I just don't understand why someone thinks they have a liberty interest in putting other people in danger or putting the community in danger. And the only way to get around that is to take the position that masks aren't effective or they don't work. And the science is so clear on that right now, but put all the science aside, just think about what we're seeing here in Austin and what that tells us and tells the rest of the country about what it's going to take. I'm nervous as I see some of the cities that are opening up now, the way we opened up. They're opening up without the discipline for masking and the like. Everybody that's tried to do without it, pulling back. California today pulled back, closed restaurants in California because as they tried to open, they're running into the same kind of thing that we are here. You see it in Arizona and you see it in Florida as well. I'm going to show you one more chart that was presented to me today that I thought just speaks to some of the misconceptions and things. This is our weekly death count in Austin. So what you see in green is kind of the baseline. It's the number of people that pass away in our city because they get older, they get sick, or they're in an accident. That green presents the baseline. The blue then shows you the deaths that are attributable to COVID-19. You can see that over time. The orange line shows what the percent is that week of deaths of the baseline. So if it is, and you can see the percentages are shown on the right side in the orange letters to me, what is the right side of the chart. So you can see that this week there were 53 people that passed away. That's that week, the last week we had reporting, 53 passed away. And you can see that's about 20% of the baseline, which is about 232 people that baseline pass away in our city. The week before was at 28. And you can see that this is, as we go through this, as we have more cases in the hospital, as we have more people going to ICUs and more people going on vents, as we add to that number, even if we stay constant, we're going to have more people that pass away, and just it's important to recognize that this is still a very, very deadly disease. All right, I'm going to change subjects. I'm going to talk about the manager's budget. Manager presented, as is his responsibility under the charter, to present a budget to the community here in Austin. When he presents that budget, it then is available for the community to give input. I have dates over here. Manager presents the budget as he did today. There are going to be input meetings from the community on July 23rd and on July 30th. The City Council is going to have work sessions to discuss it on July 28th and on August 4th. And then the budget hearings, final public budget hearings and budget adoption begins on August 12th. Manager presented his budget today, and I want you to know that I appreciate the manager's work. I note that this budget has the lowest increase in fees and taxes combined of any budget that the city of Austin has adopted in almost 20 years. The increase that the manager's budget would have is a 0.03% increase. It is an increase of about $1 a month to the average homeowner in the city. That said, I'm not ready yet to sign off on this budget. I think that we need greater assurance that we are truly leveraging this moment to move to real transformational change. And I am ready to consider that reimagining policing is going to require us first to reimagine what we think about when we think about budgeting. This budget may be a work in progress for the next so many months, and until we're able to see exactly to where it is that we are heading. I personally am less concerned about what's in a budget after 4 weeks of discussion and more interested in what kind of transformational change we have actually achieved within a year of having these conversations. So I don't look at this budget as an end product. If it doesn't get into this budget in 4 weeks, it's gone. I want to create an arc so that in short order right now, we are moving toward and achieving transformational change. And that's how I'm going to judge and grade my actions. This is just the start, I think, of undoing generations of systemic discrimination in everything that we do, including but not limited to policing. And we need to find a way that prioritizes that together with being both a safer and a more just city. So we have several weeks now to try to work through those issues with respect to budgeting as a community and as a council. The typical homeowner is going to pay, as I said earlier, about $12 a year, $1 a month, about a 0.3% increase, to taxes and fees. The average family is going to see their Austin energy bill go down this next year. Austin water bill being flat. Transportation budget looks like the transportation fee looks like it'll go up just a little bit. Austin Resource Recovery, just a little bit. It went up to $2.60 last year, up $1.40 next year. But on balance, again, if you add up all fees and expenses, the total increase is about $1 a month. And that kind of thing, again, hasn't happened since, I think, 2004. The planned increase of about 300 police officers is removed. 70 previous vacancies that couldn't be filled, removed. Frees up about $11 million out of the police budget. That's going to be spent on different items in the city that contribute to safety within the city. Pretty high level working group with some of the most senior people in city government formed to decide what it is that are the services that can be redistributed over the course of the year, what makes sense to do. Frankly, I'm interested in making sure that we don't move something just to move something. I'm not interested so much in a cosmetic issue as I am a true, real substantive change in direction and meaning and effect and culture. New Civil Rights Office, expanded Office of Police Oversight, expansions to the Equity Office, the Civil Rights Division in the City Attorney's Office. 100% funding of what had been almost an aspirational mental health intervention plan, almost $8 million going into the Housing Trust Fund, additional money for immigrant legal services, family violence prevention, new records management system for the city. It's real unfortunate. Arts funding shows a decrease. That's because the hotel taxes that fund that are anticipated and expected still to go down, which means that those of us that can need to contribute directly to those organizations to try to make up that gap. Still significant expenditures on homelessness in this city. Some of the one-time expenditures we did last year in our budget have kind of passed through. This year is augmented with one-time federal funding, but a lot of programs. There were a lot of cities around the state that have had to furlough and lay off employees or cut employees' salaries. Austin hasn't had to do that. And I think that's a real testament to your city and to the strength of the budgets that we have had, real conservative reserve policies. And when this pandemic hit, not only did we have those real conservative reserve policies, but the amount of reserves we had on hand exceeded even what those conservative policies called for. For that reason, we haven't had to lay off any workers or cut any workers' salary. And in fact, we're able, as part of the manager's budget, to give a 2% increase in salaries to city employees. There's a lot more in this budget that manager presented, help for small businesses and for nonprofits, those that are continuing to struggle with this virus. The Economic Development Department just launched 2 recovery grants this week. I think it's out of the CARES funding. An Austin Small Business Relief Grant. The application open until July 24th. It's over $16 million for grants, up to $40,000 toward for businesses to meet their needs, including rent, payroll, and other economic needs. There's also the Austin Nonprofit Relief Grant. Again, applications open through July 24th. One-time grants up to $20,000 toward reimbursement of eligible expenses. Again, rent, salary, and those kinds of things. Point out again that we've increased some of the neighborhood testing sites to get closer to some of the communities that are most challenged with the virus. The city of Austin recently rolled out 3 new ones. Givens Park neighborhood testing site actually went live this morning on its first full day of operations. The site reached capacity. Austin Public Health still working to expand to other testing sites. They recommend scheduling an appointment ahead of time, but still take walk-ups. And here's the banner that you can see to tell you how to sign up for those testing. And then finally, Anita wants me to remind you that you can organize watch parties to stay up with these evening Got a Minutes. You just go to the bottom of the Facebook, and there's apparently a button there you can press to let your friends know about these evenings, just to try to get word out. As we take a look at what we're doing with this virus, we're on the edge. We're asking the governor if we're going to be having our ICU numbers increase, if we're going to watch what's happening in Houston and Dallas, and those cases are continuing to rise, if we're going to be asked to take patients in our system from down in the valley, maybe even from some of the other major cities, then we're going to have to really throttle back even more than we are right now in the city, so that our hospitals don't get overwhelmed. So we're having those conversations around the state with mayors and talking to the governor's office. You can also watch this Got a Minute on YouTube Live. Go to mayor.com, and there'll be details about subscribing to and getting on that channel. Knowledge is the best weapon we have against this virus. All right, I'm going to conclude tonight talking about Jacob. Jacob is 4.5 years old. He is here in Austin. His dad is a doctor and does some of the hospital shifts these days. When you're talking about watching out for folks, you're talking about watching out for folks like Jacob's dad. Here is Jacob and his brother Ethan. They're seeing their dad off as he heads to the hospital. I'm a dad. No matter what's your job, one of the hardest things that you have to do is leave and leave your kids at home. But it is a pretty lucky dad who, when he goes off to work and comes back home, is greeted with artwork. Here is Jacob's art feature for his dad. His art piece. He features what he calls his planets. That's Earth, Venus, Saturn, and the stars and the moon, along with a few dwarf planets that I'm not sure we knew about when I was in school and Jacob's age. My favorite part of this is the glittery tribute to Daddy. Again, yet another reminder of how precious these years are with our kids. So those are Jacob's planets. But I am sure that his dad is his whole world. That's all we have for this evening. You all take care. Good night and be safe.